All right, let's go ahead and get started. Good morning, everyone. Thank you for joining us for our second webinar in our Return to Work series to discuss breastfeeding supports for working moms. If you know me, you know it is one of my passion areas. I'm so excited for this topic this morning. So a few quick housekeeping items. Feel free to ask questions in the chat. We have reserved some time at the end for Q&A, so we will get to those at that time. We are also recording this session, so we'll provide you with a link to the recording and a copy of the deck after our session this morning. So I thought it'd be a nice way to start by telling a quick story about my sister. My sister works for a large health system, and when she was pregnant a year ago, I told her that she was entitled to a free breast pump through the health plan. And you would be surprised how many new and expecting parents don't know that this is a benefit, which I'll share some statistics around soon. But back to my story. So she called the health plan, and guess what they told her? That she did not qualify for a free breast pump. Luckily, I knew better, but it still took some convincing and intervening. And this is just one example, but we know there are so many more out there. How many other people give up before they receive the supplies they need and that they're entitled to? For my sister, she could have afforded to pay for the breast pump out of pocket. It was the principle of the matter for her, and really for me, because I wanted to be right and I knew I was right. But for the low income workforce, that's not the case. And we need to be very mindful of that. My co-presenter today, Jennifer Jordan, is going to share that these types of issues happen all of the time. As if breastfeeding isn't hard enough, the process itself just gets a lot of moms off to a bad start, which is why we partner with Aeroflow to make the whole experience better. Today, instead of simply talking to you about the benefits of breastfeeding and why it's important to moms and babies, because I think we could both probably go on and on about that, Jennifer, I want to talk to you about why this issue should be important to employers and why employers should double down on breastfeeding supports for new moms. There are numerous opportunities to improve the return to work process for new parents with meaningful ROI for an employer. We've covered leave and return to work planning with Voya. Today, we are tackling breastfeeding supports for new working moms. And October 4th, we will discuss innovative ways to support employees with childcare needs, which is another super hot topic relevant to today's workforce. So we're very much looking forward to that discussion as well. As a mom of two who's pumped twice in the workplace, I can attest that there are numerous struggles faced by pumping moms, from figuring out all the pumping parts to bring day one, where to pump in the office, how to talk to male managers about it. It is challenging. The guilt of feeling like a less productive employee, that was very true for me. These are just some of the challenges faced by pumping moms when they return. It's hard. When new moms experience these challenges, they feel less valued, and that directly impacts retention. So definitely want to talk about how this impacts an employer. Why should we care? 60% of pumping moms lack a space to pump. This is a huge compliance concern from an employer's perspective. 27% of new moms, and I hear this all the time, say that working and pumping, it's difficult to juggle. And because of this, new moms either quit pumping or they quit working, which directly impacts retention. Plus, this is also bad for employers because low breastfeeding rates result in increased medical costs for mom and baby. And the CDC recently estimated that this costs an additional $3 billion a year. In terms of getting value out of the benefits that you offer, many new moms, because we're all about that, many new moms and expectant moms are unaware of their breast pump and lactation benefits, which means employers aren't getting the return they expected from their benefit investment. Circling back to the story I opened with, my sister isn't alone. 67% of expectant parents and 40% of new moms, wow, that number is high, are unaware that they have a breast pump and lactation counseling benefits. We've tried to bucket employer support into 3 areas where employers can positively impact the experience for new moms and babies. We are excited to partner with Aeroflow for today's session and even more broadly in supporting our participants because they have really great research and insights into how to create equitable access to breastfeeding supplies and supports. And Jennifer will lead us through that discussion for pumps and supports. After Jennifer's presentation, I'm going to address the other 2 items through our good, better, best discussion. We love to share that on our Benefit Bump webinars, so I hope you find that helpful as well. So on our next slide, what we'll cover today, not to be redundant, but in terms of how we will spend the next 30 minutes, we're going to dig deeper into the items I mentioned on the prior slide, because adopting breastfeeding supports will result in better health for mom and baby and better business results for employers. So with that, I'd like to turn it over to Jennifer Jordan, one of the senior leaders at Aeroflow. Jennifer, take it away.
Thank you so much, Sarah. Aeroflow is so excited to partner with BenefitBump. We're so happy to be here today. Just like Sarah, I too am a breastfeeding mother who really, my goal was to breastfeed my son for 12 months. And I did return to work, and the challenges and hurdles that I faced were incredibly tough, from understanding when to pump, how to store, how to speak to my manager about it, and accessing lactation support during some challenging moments during my time. So not only is this, Aeroflow's business, this is something that is so near and dear to me because I walk along with the moms in the workforce and have experienced these same challenges. So here at Aeroflow, our goal is to provide access to the right breast pump supplies and supports for moms. We're here to help her reach her breastfeeding goals. Mom's breastfeeding goals could be 6 weeks, 6 months, or all the way up to the American Academy of Pediatrics just announced recommendations to breastfeed for the first 2 years of a child's life. So we're really here to help mom along that journey with the tools and resources to help her meet her goals. What does that include? We provide breast pumps and supplies, pregnancy support and related items, pre and postnatal education, and then one-on-one lactation support when needed. We recently did a survey with almost 1,700 new and expectant parents. Really interesting information came from these moms. Among the new moms who are no longer breastfeeding, 50% of these moms quit breastfeeding due to preventable complications. We talk about breastfeeding, it's a marathon. Breastfeeding, it's natural. But it's not easy. It's a learning curve for both mom and baby. So the same way you would not take off this afternoon and say, I'm going to run a marathon with not doing that first mile, second mile, third mile. Breastfeeding works the same way. One of the greatest indicators of breastfeeding success is actually prenatal breastfeeding education. So it's giving mom the confidence, the training, and the learning to prepare her to meet those goals. Some of the things that are preventable that, kind of drive mom away from breastfeeding are complications, mastitis, latch issues, low milk supply. Again, these things can be overcome with proper education and support, such a critical piece. Going back to work, approximately 1 in 4 moms who stopped breastfeeding is because they were going back to work. They didn't know how to do both and they felt like they had to make a choice. Mom should not have to make a choice, and we're going to be able to give you some really great information as how you can be a partner in helping mom make those best decisions for herself. Sleep deprivation. Of course, without the right education and support, sleep deprivation, it absolutely happens with an infant, but there are some knowledge and tools that can help mom understand how to juggle the breastfeeding as well as getting baby and herself the rest that's needed. Establishing a feeding schedule and then learning how to use a breast pump. Almost like driving a car. You don't just jump in your car and drive across country tomorrow. Using a breast pump, the same thing. You don't use your breast pump for the first time and say, I just got 6 ounces of milk. a learning curve there as well. So really preparing mom for all of these challenges is what Aeroflow focuses on. So you as employers and benefit professionals, how can we work together to address these? Only 31% of respondents in our survey reported that their employer provides access to lactation service as part of the company benefit. And then 62% of these moms would consider changing jobs for a company that offers better breastfeeding resources and services. And kind of going back to Sarah's story about her sister, it wasn't that this benefit was not eligible. It was navigating it through the very challenging path of calling a health plan. You're speaking to someone who isn't necessarily an expert on just your maternal health benefits. Sarah's sister was talking to someone who's going to answer a question about a completely different medical device before and after her sister's phone call. So how wonderful is it to have the team at BenefitBump that is an absolute expert and focuses on helping mom through these specific benefits so that she can get the proper information? Because what I suspect is these 31% of moms who reported their employer provides lactation support, the delta, those moms probably have lactation support. They probably have this benefit. The benefit is not put in front of them. Someone is not walking them through the benefit, and the education is not there so that they can even be confident to consume. And how disappointing for an employer would it be to potentially lose quality employees when we have a tool in BenefitBump to be able to put that information in front of mom so that she understands the benefits that she has at her current workforce. I think something really important to discuss is equity and availability. Kind of as Sarah and I spoke, we had challenges as we went through our breastfeeding journey. We had support. We maybe had a stronger voice than a lot of employees do. So making sure that we really look at this from an equity and availability standpoint. So looking at a workplace policy, ensuring the employer policy supports birth parents' return to work. This is the discussions as the employee or spouse is getting ready to go on leave, and also a plan for returning. And also creating an environment of understanding. I think there is a society-wide approach to breastfeeding support. It takes all of us. So training managers and coworkers and creating social norms to create support surrounding the breastfeeding employees. Affordability. Not all health plan policies are created equal when it comes to supporting breastfeeding policy. There are some that, it's almost a hollow benefit. Do they check the box? They check the box of a breast pump with a manual pump. No one can go back to work and be successful with a manual pump. A hollow benefit surrounding lactation, meaning it has to be seen in person or with a nurse practitioner, someone who doesn't necessarily have specific training surrounding lactation. So really there are some health plans. There's definitely some health plans that we give, 2 thumbs up, and some that need some work. So understanding the plans and the affordability that actually provides the employee. If you're creating your own benefits, you may consider a carve out just to allow for and identifying the most robust services that meet your workforce needs. And we absolutely understand not all workforces are equal or have the same needs. So really listening to and understanding your employees and how they work and what that might mean. And then access. So ensuring access to quality products, not just products where there are choices. And then consider the workforce. Where are your employees stationed around the country? Access to virtual and in-person education. A lot of more rural areas, there's not even a lactation consultant that lives in that area that may be able to see mom face-to-face or in person. So ensuring that virtual care is available for lactation is absolutely critical when mom needs that help. And then looking at the breast pump options and making sure that the right pumps are available based on the employee's needs. So what does that comprehensive strategy look like? I think this is why Aeroflow and BenefitBump really enjoy working together to support moms, because we've kind of talked about this gap in benefit education and understanding. The concierge service at BenefitBump really helps mom or, dad, as they're going through this process, understand the benefits that are available. The Aeroflow breast pump team kind of steps in at critical points throughout the pregnancy and postpartum to help the customer understand, here is the time to go to your prenatal education class. Here is the time to take a pumping class. We have patients calling us every day, and they're facing decision paralysis surrounding a breast pump. So we focus on talking to the patient surrounding, how are you going to be pumping? What are your needs? Do you travel? Do you have space at work? Are you going to be on the go? Do you need a portable breast pump product? What about storage? Is there a refrigerator at the office that you're going to be able to store your breast milk in? Different size flanges and supplies. All of these things kind of change through the breastfeeding experience. And we're here to kind of speak to mom to make sure that she's getting all of the breast pump and education pieces needed. And then the lactation classes and counseling are so critical. One of the greatest indicators of breastfeeding success is the prenatal education class. So not only education to prepare for breastfeeding, but then once baby is here, if mom and baby are having struggles, having those classes, support groups, and one-on-one appointments available, and then holding mom's hand as she gets ready to return to work. We have some really robust checklists and tools so that mom can be confident and ready to walk back into the workplace.
I love that, Jennifer. I mean, there's so many things that you've said that have resonated with me, but definitely, the questions, breast pump paralysis is real. There are a lot of options and trying to figure them out. I mean, quite honestly, when you're not in the business, like I wasn't as an attorney, it was very hard to navigate. And I love that, you're asking moms questions about what's available via their employer, what are the rooms, what's the setup like, what are their needs. And that's where I think it's such a nice partnership between the two of us, because we are digging deep with an employer to get access to, again, what are their lactation rooms, where are they, what are those processes like, so that mom is able to kind of relay that information to you all and know what that is, so that you can help her create, find that best breast pump for her.
It's a mouthful, exactly.
It is. And oh man, I ran a marathon probably twice without training up for it. So definitely appreciate that comment as well. On the return to work side, as we shared in our last webinar, 87% of new moms said returning to work was difficult. And then on the next two slides, I'm going to go through some good, better, and best recommendations, as well as an action plan for employers so that we can help you get there. So on the good, better, and best, things that we can be thinking about as employers, as consultants to those employers, step 1, step 2, step 3. Starting with sort of step 1, things to be thinking about in the next few months or next year, some good things. 1, do not require, employees to clock out to pump. When we're trying to work, let's say an 8-hour day, and pumping can take each session 20, 30, 40 minutes, setup and all of that, it really extends the workday for a new mom if she's having to add that pumping time on top of her 8-hour workday. So not requiring employees to clock out to pump. Definitely want to make sure that we are working toward that. Secondly, ensuring that employees know how to access their lactation benefits, which we've talked a lot about, Jennifer. It's so important, pumps, supplies, that educational support. Very nice way that we work together to help employees know and take advantage of those benefits and resources. But as an employer, you can definitely do that as well to make sure your employees know where to go and what they will get access to through the health plan. Revisiting the covered pumps to make sure it's equitable across the workforce. Jennifer, I know you mentioned that it can truly kind of vary based on health plans, based on the geographies. So making sure we know what's provided to employees so that it's equitable across the workforce. And lastly, a private place for employees to pump. And Jennifer, we've talked about, step one is just making sure employees have access to that private space, preferably a lockable door that's private, that's just for lactating moms. It doesn't have to look like a Ritz-Carlton suite, although, we wouldn't mind that. But for manufacturing, lots of industries, we know that it's hard to sometimes find those spaces in the work sites, but just being super mindful and revisiting where those lactation spaces are, that they're available. Obviously, there's Mamava and other folks that can help think through those, but step one would be to make sure that you have that space for new moms. Better would be pumping up your existing mother's rooms. Again, if we're going to go beyond sort of that space, that lockable space, what are some other things that you can provide to make that room supportive? The list sort of goes on and on, lots of low cost things to add. For me, it was oil pens, cleaning supplies, making sure there's a sink there, making sure there's a fridge, any additional supplies, lots of, again, low cost things that employers can put in those rooms to really enhance that experience and support for new moms. Secondly, on the better is covering 2 pumps with ample supplies would be very nice for your breastfeeding population. I know for me, I had one through my health plan. And so I was constantly lugging my pump back and forth, kind of felt like a bag lady, Jennifer, a little bit, with all of the things that I needed. So as we're doing return to work now, sort of in this, I guess, post-COVID or now into this return to work phase, covering 2 pumps so mom can leave pump and supplies at the office would definitely be a better practice for your workforce. Reimbursing that milk shipping. So business travel is up. For your traveling moms, that breast milk is liquid gold. It's absolutely liquid gold. So how do we make sure we can get that breast milk back to mom? So for your traveling employees that are pumping, either reimbursing through milk stork or just a direct reimbursement to the employee will really go a long way, not only logistically, but making them feel really valued and included by their employer. And lastly, on better, provide sufficient lactation counseling resources. Jennifer, I think you hit that so nicely, but really digging in and knowing what's offered and covered in different geographies and making sure folks have access to the digital resources and things so that they have that lactation counseling resource and that it's an affordable cost for them. On the better slide, providing ramp up time. So I'm a really big proponent of ramp up time to help with that breastfeeding time struggle. So coming back to work day one with that full workload is challenging. I can definitely speak to that firsthand when you're trying to fit in those 2 or 3 pumps during the day. So we are seeing companies, innovative companies, move toward what I would say is a little bit of a reduced sort of schedule or model for those in the legal field, for those new moms returning to work for those first few months so that they can not have that 100% workload, which then obviously allows for some time for breastfeeding. Next would be employer lactation space with that multi-use pump. Again, we could go into all the supplies and kits and things like that. So if you have questions about those, feel free to follow up afterward. But the Medela Symphony pump is a great pump that I know a lot of employers are starting to put in their lactation spaces. And that just allows a mom, different moms throughout the day, to plug into it again so that they're not having to lug their pump and those other supplies, too many additional supplies with them to the office. And lastly is education. So proactively outreaching to employees on what to bring, where to go, where the pump rooms are, how to access it, how to reserve it, how to talk to their manager about it. So we do a lot of that, as well as Aeroflow and kind of what to bring. So really nice partnership there. And then the manager training. We talk a lot about that, but what does it look like for us? proactively outreaching. This would have been really helpful for me as a new mom employee if my managers maybe knew a little bit about what I was sort of going through at a high level and what supports I needed. It would have taken some of that burden off of me. So talking with managers ahead of time, having that manager training, that manager conversation, so that they know kind of what's going on when that breastfeeding mom returns back to the office. And Jennifer, I didn't know if I know I took a while to cover those. I didn't know if there was anything that you wanted to add.
Yeah, Sarah, I think what's so important to note is you may not be able to do everything on even the good list. I think it's picking out something that is actionable and doing it. So don't feel like, oh my goodness, because I can't provide a private room with a sofa, with all of these add-ons, I can't provide a lactation space. Start with partitioning office space. Start with just, trying to do the absolute basics so that these employees know. And I can tell you at Aeroflow, we've done the same thing. We have to move from something that was, just a little larger than a closet. It was the space we had, but we put outlets in it. We put lighting in there. We did within the space we had the best we could, and then have upgraded to now a beautiful pumping room for our moms. But that wasn't what we had day one. So I think my encouragement would be do something and don't worry about, doing everything when you kind of adopt whatever a pumping room or what this support piece might look like.
Right. Don't get overwhelmed by trying to boil the ocean. Take one or two things and make those action items, and then, create that path or that plan to get there down the road like Aeroflow did. And I think a lot of employers are doing as well, step by step. So I love that. And for us, it's how do employers get there? I know step one, we like steps 1, 2, and 3 here at BenefitBump. So step one would be to simplify your resources, make sure the supplies are supportive and consistent across the entire population, which is more prominent when there are multiple health plans and geographies and things like that we've talked about. Next would be make them easy to find. So we're a great way to consistently bring resources to an employee when they need it most as that single point of contact. But also, again, employers creating that proactive outreach for those moms. It's definitely important so that they can take advantage of the resources and supports that they have. And lastly, modernize your workplace settings for new moms. Revisit your lactation rooms as folks come back to the office and as more people begin to travel for business. It's a good time to revisit and then modernize your workplace and your additional supports. Again, I could go on and on, Jennifer, about the cleaning kits and oil pens and separate milk fridges and comfortable spaces with sinks. But like you said, let's start somewhere. Let's take an inventory of what we have and then start marching down the path. And those low cost items, which I'm a big proponent of, I just think makes that experience, it makes a huge difference to these new moms coming back into the workplace. And I will tell you that would not be lost on your new mom employees, those efforts. So with that, I think we are going to move into Q&A. Thank you for showing our contact information. If you have questions for us sort of outside of the presentation, questions about your specific workplace or workforce, I definitely want to make sure that you have access to the contact information so that you can ask those questions. And then I did want to look at the chat, so I will go ahead and do that. Looks like we got a question in. From your experience, when employers offer reduced work schedules for a couple of months to new moms, does this mean that those employees don't receive 100% of pay for that time? That has not been the case in my experience. So for the employers, we have a few that do offer ramp up time, so a little bit of a reduced schedule. They are still continuing. Oh, yes. Thanks for. Oh, Scott, are you going to unmute everyone? Or if you haven't been unmuted and you have a question, definitely feel free to unmute. But to go back to the question, in my experience, they are still being paid like they're working 100%. So it's a benefit. It's a little bit, again, of that reduced schedule, but the 100% of pay for a month or two as moms are coming back into the workplace. Let's see if there are any live questions. Hopefully you all can unmute if you want to, and happy to open it up to some live questions. We do have some questions that were emailed ahead of time, but I want to make sure to give folks the ability to ask questions on the call. But I'll go ahead and start with a canned question. Feel free to type in the chat, and then we can read it aloud as well. But had a question come in previously. We sort of alluded to or used the term carve out earlier in the presentation. What would a carve out look like, and the cost for the lactation support with that carve out? And Scott, I think you are a good person to answer that question.
Yeah, happy to. So we've been working with Aeroflow on trying to create a carve-out solution. And this is really to address one of the comments that Sarah had made earlier and Jennifer had shared as well around sometimes the unevenness in how the benefits delivered. So maybe the health plan you're working with is not providing a benefit that reflects what you'd like to offer, or maybe you offer multiple health plans, or you're with a Blue Cross plan where the DME benefit varies from state to state. So the way we've envisioned a carve-out benefit with Aeroflow is to establish bundles of lactation counseling, kind of pre-birth classes, as well as supplies, and to really bundle that with benefit bumps, benefit navigation, and return to work support solution. And so the idea would be that you would carve out all of these lactation resources. Benefit bump would be the front door, or Aeroflow could be the front door, and we would guide folks through a very consistent experience with the same access to, great pumps, supplies, coaching, counseling, and guidance. And it's surprisingly inexpensive. So it may sound like a luxury item, but if you look at what you're currently spending, it would be a small incremental cost. I think we estimated it could cost potentially just a couple thousand extra dollars per 1,000 employees you have. So if you have 10,000 employees, you might be looking at incremental cost of $20,000 to $30,000 a year. And we'd be happy to unpack that for anybody who'd like to ask after the session.
And Scott, another question for you. So for our consultants and employers on the call, what should they be asking the health plan to verify how the coverage works today?
Yeah, so I'll admit, so I spent most of my career as a consultant, and I don't remember asking in an RFP for folks to verify kind of what services were covered or not. But I think the two simple questions are just to find out what breast pumps are actually covered, how the process works by which somebody can obtain their breast pump, because there are some plans that might use a healthy pregnancy program as a gate. And then also how lactation counselors can be identified and how they're covered. I think when we were doing a search recently, maybe one of the major health plans through their provider search, could you actually find a lactation counselor? And I think, Jennifer, correct me if I'm wrong, there are some health plans that, and I think you mentioned this earlier, really are not providing access to, licensed or certified lactation specialists, through their covered benefits.
Yeah, Scott, I think it's something that's so new. Even though it kind of came along with the Affordable Care Act, that lactation counseling and services piece, really the gold standard is an international board certified lactation consultant. They do almost 1,000 hours of, in-person and training to be able to be certified in lactation. And there's some health plans that there's not even a network for lactation consultants, and kind of how they're designated and how you navigate and bill through an IBCLC is still very muddy for a lot of plans. So it could be pushed through to a pediatrician or to a nurse practitioner who, while they absolutely have expertise, it's not specifically in that lactation arena. So the mom may still not be getting the support she needs when she heads over to the NP or the pediatrician. She really needs to be able to look for that lactation professional.
And I have another question. Jennifer, this one is for you. So a couple of times in the presentation, you referenced sort of addressable issues that could lead to better breastfeeding success. Can you remind us, give us some examples of what those sort of addressable issues are?
Yeah, absolutely. Kind of when we look at barriers to breastfeeding, knowledge, right? So providing education and support. And I bag that all the way up to when mom walks into HR to her manager and says, I'm expecting. I think that's the point where we absolutely should activate to start saying, how do we walk this patient all the way through up till birth of baby and then move towards the return to work? We have really simple things like checklists on our website. It doesn't have to be complicated, but when we're looking to how do we provide knowledge and success, even a pumping schedule, helping mom set up her pumping schedule, helping her look at cleaning and storage guidelines, helping her look at a back to work checklist is kind of like the checklist when, you know, you're going back to school for the first time. Now that you've had baby and you're walking back to work with all of your breastfeeding supplies, making sure that mom understands everything that she needs. But knowledge is one of the greatest barriers, and a lot of these things can be overcome by just having some of these proactive conversations. Embarrassment is another barrier to breastfeeding. So again, if we're just kind of normalizing these conversations, you know, everyone has different personalities, and I may not feel comfortable walking into HR or my manager and talking about breastfeeding. It can be a very sensitive subject. So if it's already part of a benefits guide and part of this kind of walking through the pregnancy and then return to work, it becomes normalized. And so that stigma of embarrassment and knowledge, you've all of a sudden removed just by having a really clear policy in place and working with someone like BenefitBump to hold mom's hand through the process.
I love so much of what you said there, Jennifer, because it's what I needed. I think it's so much what moms need. They need that education, that proactivity. Again, we're planning for a marathon, and so not trying to lace up your shoes day one and run it is definitely the key. So just as I wrap up, thank you so much for joining, everyone. You know, we're so excited to work with Aeroflow, BenefitBump sort of serving as the hub for, again, as Jennifer mentioned, concierge program from pre-pregnancy, pre-adoption, all the way through return to work, a connector, a hub, proactive educator for all benefits and resources, benefit plans, clinical supports, financial and emotional well-being, childcare, which I know we're going to cover on our next call, but that time off planning and return to work, breastfeeding is a big part of making sure that return to work is smooth and back into the office. So having those conversations with employees early and often about employer provided, publicly available, and making sure they're getting connected to Aeroflow for all of that support with breastfeeding, supplies, lactation counseling, and all of those things. So we're so grateful to have you, have had you with us here today, Jennifer. Absolutely love the Aeroflow program, all of the supports, just a wealth of knowledge that you all have created. So anyway, from one pumping mom to another, thank you so much for all of your help for moms, and then for helping employers get the ROI that they need.
Sarah, thank you so much for letting us join today. Breastfeeding and mother success is our passion. So hopefully we've provided some nuggets and resources that can be very useful to the participants today.
Well, with that, we will see you all on October 4th for our childcare webinar. And again, feel free to reach out to Jennifer. We'll circle back, Jennifer or I will circle back with the deck and the link to the recording and a few takeaways, because we always love to circle back with takeaways. It's another thing here at BenefitBump. But it was good to see everybody on the call. Hi, Olivia. It's good to